Upholding Legal and Ethical Principles. This is a quick review from the Claywell book. Our objectives are to define professional negligence and identify issues in nursing that constitute malpractice, the meaning of accountability, defining ethical principles, and the need for nurses to demonstrate ethical duties owed to self and others. Legal versus ethics. The law mandates how we must behave toward each other. Ethics establishes how we should behave. Ethics is a branch of philosophy. Nurses, lawyers, physicians, each have a code of ethics based on general ethical principles. Any ethical judgments require an assessment to assess a situation. There are sources of law, like criminal law, govern society to include common, statutory, and administrative. Criminal law is a subcategory of the major laws. Common law is also known as case law. This is law that has arisen from judicial decisions. These are judge-made decisions. Administrative law controls the administrative operations of government, but does not govern federal treaties or judicial misconduct. A statutory law. This is an enacted law. For example, the Nurse Practice Act. Legal principles. Confidentiality and the right to privacy, which means you close the curtain or you shut the door. You give them privacy. Health Insurance Portability and Accountability Act of 1996, otherwise known as HIPAA, means you do not give out information. Failure to follow this act could result in civil and criminal penalties. Patients have rights. They have a right to be treated with dignity and respect, privacy, decision-making, confidentiality, access to health records, and the right to refuse treatment. Informed consent. Patients must fully understand what they are consenting to for the consent to be valid. And informed consent is grounded in the principle of autonomy. Assault and battery are legal principles. Assault is a deliberate threat to physically harm another, where battery is actual and intentional act of touching another without their consent. This includes giving medication when a patient refuses. Another thing to keep in mind is false imprisonment. Verbally or physically forcing an individual to stay in a place against their wishes. Now, this is not the same as someone who is committed to an institution. Negligence and malpractice. Professional negligence is also called medical malpractice or professional malpractice. This is an omission or commission of an act that departs from the standard of care that a reasonably prudent person would do in the same or similar situations. There are 4 elements that have to be present for a person to recover damages for malpractice. We look at the duty to care. An obligation exists to conform to a recognized standard of care. The breach of duty. There must be a failure to adhere to an obligation and a deviation from a recognized standard of care. Injury is the actual damages that have occurred. And causation is that injury was foreseeable. It was caused by a breach of duty, and the conduct was the cause of the injury. Standards are used to prove malpractice, like facility policies and procedures, protocols, job descriptions, professional literature, expert opinions, the State Nurse Practice Act, and the Reasonable Person Standard. Following the standards and using common sense can decrease the risk of malpractice. And accurate documentation will provide the best defense to a lawsuit. Accountability would be your willingness to assume responsibility and accept the consequences for your actions. Tort law is a civil wrong, and this is a legal wrong committed against a person or property. Intentional torts are assault and battery, false imprisonment, fraud, invasion of privacy, and slander and defamation. An unintentional tort is professional negligence. Preventing malpractice. There are guidelines to prevent negligence and malpractice, and that is performing only those skills that are within your scope of practice, staying current in your field of practice, delegating carefully and legally, administering drugs using the 6 rights, being aware of your own strengths and weaknesses, and advocating for your patients. The high-risk areas are medication administration, and most errors are wrong dose, wrong technique, and wrong drug. Another high-risk area is going to be the emergency department, followed by mental health settings and then specialty areas. The most common malpractice claims against nurses is failure to follow standards of care, failure to use equipment in a responsible manner, failure to communicate, failure to document, failure to assess and monitor, and failure to act as a patient advocate. Failure to rescue is a lack of timely and appropriate response to changes in a patient's condition. Failure to recognize clinical deteriorations. Failure to communicate and escalate concerns. Failure to physically assess the patient. Failure to diagnose and treat appropriately. It is failure to prevent a clinically important deterioration such as death or permanent disability. It is critical to monitor patients carefully to identify deteriorations and intervene appropriately. And it is sentinel events. The function of electronic health records is for accreditation and regulatory compliance. It helps make reimbursement determination and is examined by licensing boards for disciplinary action. There are documentation errors that can happen with electronic health records, like faulty record keeping, failure to include information, charting after the fact, misplacing records, and failure to follow standards of care when charting by exception. As a nurse, you must be aware that there are legal consequences for not reporting child abuse and neglect and elder abuse and neglect. Nursing ethics. Ethics is a branch of philosophy that offers a way of examining moral life. It studies how people make decisions regarding right and wrong. Bioethics applies ethical theories and principles to moral issues and problems in the practice of medicine. Morals are what we believe to be right and wrong. They're often based on religious beliefs, culture, social influences, and life experiences. A moral person is one who responds to needs and demonstrates care and responsibility in relationships. Values are enduring beliefs or ideals. They're largely shaped by one's culture and can sometimes have value conflicts. Moral development. This is how an individual learns to handle moral or ethical dilemmas. Nursing ethical principles. Autonomy is the freedom to choose and make one's own decision. It is self-determination. Beneficence is preventing harm or promoting and doing good. It is the most critical ethical principle in healthcare. Fidelity is practicing faithfully within the legal boundaries and keeping promises. Justice refers to fairness. Non-maleficence means do no harm. Veracity, this is truth-telling. Cultural differences must be recognized and respected, and a culturally competent nurse entails integrating knowledge, attitude, and skills of the culture of patients, families, and the communities they live in. The more insight you have into your own values, attitudes, beliefs, and practices, the more you are prepared, and cultural competence also extends to the workplace. Ethical dilemmas exist when a conflict arises among healthcare professionals, patients, families, and a healthcare organization. Moral courage is deciding on the right course of action regardless of the possible consequences. And moral distress is situations in which an individual knows the right action to take but feels powerless to take that action. The Code of Ethics for Nurses is a professional commitment. It provides a framework for ethical analysis and decision-making. It is non-negotiable and refers to a patient's self-determination to make their own healthcare decisions. It is applicable to all practice settings and a variety of nursing roles. It expresses ethical duties owed to ourselves, our patients, society, our employers, and our colleagues. Ethical decision-making. This is an 8-step model. First, gathering relevant information. Second, stating the practical problem. Third, identifying the ethical issues and questions. Fourth, selecting the ethical principles and/or theoretical frameworks to be considered. Fifth, conducting an analysis and preparing a justification. Sixth, considering one or more counter-arguments. Seventh, exploring the options for action. And lastly, number 8, selecting, completing, and evaluating the action. The Patient's Bill of Rights states that the patients have the right to access their health records, the right to refuse treatment, the right to confidentiality, and the right to be informed about their medical condition. An alert, competent patient wants to leave the hospital, but the nurse thinks the patient should see the physician before leaving. The nurse restrains the patient to the bed, Which action did the nurse commit? Assault, informed consent, false imprisonment, or unintentional tort? The first two to put to the side are 1 and 2. An assault is a deliberate threat to physically harm another and is a crime. The nurse did not threaten the patient, but actually restrained them to the bed. Number 2, informed consent is when a patient must fully understand what they are consenting to for the consent to be valid. Well, the nurse did not perform informed consent. Looking at now between 3 and 4, and between those two, number 3 is going to be the correct answer. False imprisonment is verbally or physically forcing an individual to stay in a place against their wishes, and it is an intentional tort. Number 4, an unintentional tort includes professional negligence.